Seven, 6, 5, 4, 3, 2, 1.
Hi, everyone, and welcome to another episode of CBD Talk Podcast. And we have got a fun one for you tonight. Lots of great information. We are being joined by Rebecca C. White from Converse with the Nurse. And Rebecca specializes in helping people with cannabis medicine. So thank you for joining us. I so appreciate this. We have so much to learn from you tonight.
My pleasure, Dawn. Thank you.
So, first of all, tell us where you're located.
I'm in Portland, Oregon. I'm a cannabis nurse here and herbalist and registered nurse. So, yeah.
Fabulous. And just to let you guys know that at the end of the podcast, we are going to, or towards the end of the episode, we're going to talk about how you can work with Rebecca and just really be able to get some good guidance there and how to use cannabis and the best way to help with your symptoms and with what you're dealing with. So how about we start out with you telling us how you got started working with cannabis?
Oh, I would love to. So I've been practicing botanical medicine, studying herbalism for over 20 years. And I wasn't really that into cannabis because I was learning all the magic of calendula and dandelion and all of those beautiful plants. Herbalism led me to nursing. So I went and got my nursing degree because I was really into the science of how the body was working. And of course, working as a nurse creates a little bit more income than working as an herbalist does. But I still maintained my gardens and lots of, potion making and medicine making happening and sharing with friends and family. In 2014, I got diagnosed with breast cancer. I have the BRCA1 gene mutation.
Oh.
So super high risk for breast cancer. My mom died of breast cancer. My auntie, my nieces are all getting Previvor surgery. So yeah, I got breast cancer. And, of course, we're going to do everything we can. I'm the type of girl who wants to use all my tools.
Mm-hmm.
So we went the chemotherapy route. And the first round of chemotherapy, I thought, I'll just use my herbs, my ginger, and all of those things to help me get through this. And I was so sick.
Oh.
And then the second round of chemotherapy, I thought, I'll try these pharmaceuticals, which was even actually worse.
Oh.
So before my third round of chemo, I walked into my local dispensary, which was Panacea at that time, and got set up with some stuff that would really help me through chemo. And honestly, I was just vaping at that point. I had one of the original Paxes that you would put the flower in, vape, and the change was astronomical. I could eat food. I wasn't nauseous all the time. I didn't really have an appetite, but I could eat food, which I hadn't been able to do in a couple of weeks, keeping down really.
Yeah.
Yeah. So cancer brought me to cannabis. And from that, I met a gentleman, Michael Munakata. He is a Hawaiian dude, just brilliant. And he and I became fast friends, and we started just really delving into the science of what was happening and why we were doing this, and used cannabis. I didn't use it as much post-mastectomy for all the reasons, but then I do have a bit of chronic pain from the surgical interventions, and then I got reconstruction, and so I use it all the time now. But when I had my hysterectomy, my preventative hysterectomy, because I still had a really high chance of getting uterine or ovarian cancer, I solely used cannabis.
Oh, wow.
And that was a real test for us to see if, does this work in the same way that these pharmaceutical pain remedies are working?
Yeah.
It was, yeah. I was shocked and amazed. And so Micah and I decided, well, he was working as a bud tender, and we're seeing people come in with just like intense disease processes, comorbidities, all different types of things. And so he would call me and we would talk about what that means and then what the cannabinoid therapy would be. So we started Converse with the Nurse.
Nice.
Was just at the time, we started that in 2015, was just being in the dispensary, talking to people about using cannabis medicine. And that's really where the learning curve came.
Yeah.
And yeah, I mean, I don't know, hundreds of people coming in with like, you know, metastases cancers, stage 4 cancers, like debilitating MS, like all types of stuff that you're like, wow.
Yeah.
So that's what kind of sprouted this Converse with the Nurse. And from there, I've just been working with clients over the years and really seeing success and people doing so well that it's super exciting. It's super exciting.
Well, it's just so great that you live in a state that you're able to get the cannabis so that your cancer treatment was bearable.
Yeah.
You know, that first time. It's not even available to more than half the country. So, well, okay, maybe I'm not sure how many states it is. So I shouldn't say more than half the country. So, but a lot of people, yeah. So,
here, for sure.
So for the people, and we talk a lot about on the show, we talk a lot about whole plant cannabis, in addition to the CBD, because we fully believe that the entire plant needs to be legalized just across the board, nationwide. Be done with this BS, and let's just stop screwing around. So,
right.
But what about the people who are not in legal states?
There are still hemp, because hemp's legal.
Well, I mean, like CBD is legal, but I mean, they can't get the THC side of it.
Right.
How can someone what kind of help can you get with just CBD?
Oh, you can get a lot of help with just CBD.
Okay. Because like I'm with you, like if I was diagnosed with cancer, you give me the whole flower. I'm not dicking around,
Yeah.
And then of course we also have to realize that there are people out there like nurses who get tested for THC and will lose their license. Yeah.
And the risk is too great.
Yeah.
Which is why the citrus CBD is magic, because they found a way that we still can get that cannabidiol, because that molecule in and of itself is really potent for homeostasis.
Yes.
The THC definitely offers other things and then modulates with the CBD, but we have found success with just CBD.
Yeah, that's good. Yeah. And that's good to know, because truly there are places where that's all you're going to be able to get. And so, like, that's what we are. We're the podcast, we're CBD Talk Podcast, because we try to help everyone. And we actually have a lot of people in other countries that listen as well, where THC is definitely not legal in any way, shape, or form. So, so we've got that. But I really do appreciate states like Oregon and Colorado and California, and Nevada, where you're sick, or even if you're not sick, you can go and you can get what you need to help yourself heal. So for the non-THC states, that's what the internet's for. And I've had George. So Rebecca works with George from Citrus CBD a lot, and they've done webinars. I actually posted something about that one webinar that you did about a month ago, to try to tell people, hey, get in there if you can. I didn't have much notice on that, but so
Yeah.
next time if you do another one, let me know so I can spread the word. Um,
Yeah. The end of April, we're going to do one focused on breast cancer.
Oh, nice. Okay,
Mhm.
I'll get that information from you later, and I will make sure that I put something out about a week before to let people know about it. Um, so when she was talking about the citrus CBD, George has been on a couple times now. So if you go back and look for episodes with George Walters, Wolters, the first one will talk about more about citrus CBD and how it's a non-hemp derived CBD, and which is awesome. It's from lichen and citrus. And
Yep.
then the second episode, which was just about a month ago, I think, was about the transdermal patches that he has. So that's who Rebecca's referring to. Been on a couple of times. Great guy. And if you haven't listened to his episodes, go back and listen to them.
Yeah. There's another company I want to mention about the hemp. It's called Siskiyou Sungrown, Siskiou, Sun, and it's a organic cannabis farm in Southern Oregon.
Nice.
Theirs was one of the first medicines out on the market.
Beautiful.
And that's primarily what I see people who are dealing with intense disease use. And they have really high quality hemp stuff. And like you said, it's not just the one thing. We as herbalists like what we call the entourage or the ensemble effect with all of those different terpenes and flavonoids and all of those things in the medicine too. So Siskiyou Sungrown is a really quality hemp products. And I'm sure, Dawn, you have stuff too, but you know, the internet's wonderful. Online's amazing.
Here's the thing.
You still have to know.
Yeah. Because here's, we've had several episodes where we've talked about people who were not labeling what, things properly. And so you have to be careful.
Yeah,
And
you want to be a good consumer. You
Yes.
want to know where your medicine is coming from, especially with hemp, Like I tell people that with other herbalisms, like if you're going to get, chamomile tea, you want to know that it's good, high quality. It's not sprayed down with pesticides.
And let's also remember that we have a lot of stuff coming in from China, and
Yes.
that's laden with heavy metals, and that is not something you want to put in your body. So
And hemp is a bioaccumulator. They actually used it a lot to clean up Chernobyl. So
as they're
take
doing
all
in
of-
China,
Yeah.
yeah.
So be really careful as to
Yeah.
what the product is.
And so that's one of the reasons why I'm having you on here and why I have a lot of people on here. I want our listeners to know that they can go to a website and talk to someone and get referrals about what products are good. The people, like when, I have had 60 plus episodes, 70 plus episodes. I don't even know where I am anymore. And these are people that you can contact. You can go online, look them up. I put in the show notes, I put contact information about these people. Call them and have a conversation. And if they've been on my show, they've been vetted. I turn down so many requests to be on the show. I can't even tell you. But
Thank you.
yeah, so you should always have a relationship with the people that you are getting your CBD from.
Yeah.
So, all right. So let's jump in here because there's so much that we can learn from you. One of the things that I talked about, and I'm so excited to have you on here, is contraindications.
Yeah.
So there are things that don't play nicely necessarily with CBD, and a lot of times that's just shoved under the rug. And there's always ways to work with it and ways to, compensate in certain instances, like either by the method that you're taking it or, tapering off one as you're building up on the other. There's lots of different things. So I am just going to shut up and listen.
Okay, wonderful. So if we talk about contraindications, we first and foremost across the board say if you take any medications that say avoid grapefruit, you should also avoid cannabis and hemp. because they have the same enzyme that breaks down the pharmaceutical. And so what will happen is you'll have more pharmaceutical circulating in your body. It won't be metabolized like it normally is. That little piece of information is good when we're dosing down on the opiates, because a little bit more CBD can help you take less because you have more circulating in your body. But we want to take 40 milligrams of CBD or THC. 41 will start to impact the other pharmaceuticals that we take, whether it's grapefruit or not. So if you have a medication that you avoid grapefruit, hemp, CBD, cannabis, not for you.
Got it.
If you are on a medication, if you're on pharmaceuticals, then 40 milligrams is your tap out.
Okay, so up to that amount.
Yep.
Got it. Okay.
40, 45 will and this is generalized. Of course, everyone's so individual, which is what's beautiful about it all. But about 40 milligrams will start impacting your other pharmaceuticals, because it's about the metabolism and the breakdown in the liver that happens. It's called the P450 pathway, and it clogs that up so that the other chemicals in your body don't get metabolized. They just stay circulating in your blood.
Okay, so that's very complicated for me.
Yeah. So, well, but I guess the take home is, if you have meds that avoid grapefruit, not for you, and then 40 milligrams is
Got it.
If you're on other pharmaceuticals, just end there. Or give me a call. Let's talk about it. Like, what could we up and down,
Yeah, that's okay. And that's really what I want people to also get from this is that there are people out there that can help you. You don't have to do this alone.
Yeah, for sure.
So.
There are entire cannabis nurse networks. There's the Cannabis Nurse Network. There's the American Cannabis Nurses Association. And actually, that's where I got a lot of my training, was online programs from them, which cover the whole gamut, which it's super geared for medical professionals, but it's also really understandable and lovely. So those are good. Anyway,
so what other medications? Okay, so like we talked a little bit beforehand here, and one of the things that I had brought up was Nsaids, and so lots of people are on Nsaids.
Yeah,
and one of the great things about CBD is that it can really help when it comes to reducing your dependency on Nsaids. So how about how would you recommend transitioning from, like, if you take, let's say you take let's see, I don't know, 4-6 leave a day. And first of all, what is a leave doing to your body?
Well, as far as the NSAIDs go, they're non-steroidal anti-inflammatories. So we have a couple of different classes: the Tylenol, acetaminophen, the NSAIDs, which is naproxen sodium. It's actually stopping the inflammatory cascade from happening and don't get as inflamed. So that's why it works great in acute situations. You sprained your ankle, you take an NSAID, and it will help that swelling go down. If you're taking them regularly, day after day after day, then your inflammatory and your immune system gets a little confused. Like, what? We haven't had any of this in days and days. And so then it starts like dysregulating it. So one, the NSAID doesn't work as well. And then two, you're also looking at the side effects of the NSAIDs, which NSAIDs are really hard on your heart. So if you have any heart conditions, then you kind of want to stay away from those NSAIDs, or even just take them here and there, but not on a daily, all everyday basis.
Yeah.
So, and how we've done, getting off pharmaceuticals and uploading with cannabis, whether that's, I had a person who was taking 17 oxycodone a day.
Yeah. Mm-hmm.
And right now she's on nothing.
Yeah.
She weaned herself off of the cannabis as well. So that's how well she's doing. And that's how amazing this plant is. It like truly heals us.
It is.
Does
And,
just
and you said something that's really important to people, I think, is she's not even taking the cannabis now.
Yeah.
See, that's one of the things that's so great is that your endocannabinoid system, I mean, it could be pretty damn deficient right now. But by increasing your cannabinoids and boosting it and getting it up and running again, it doesn't mean that you're switching from one thing every day to another thing every day. Right. Your body can it can heal itself, and it naturally does make cannabinoids, or it's supposed to.
Endo.
Yeah, exactly. So it can kick back into gear again. So
yeah, it's amazing. It's amazing.
So what is so that right there is huge, that she's completely off, and
yeah,
God, I love that.
Yeah.
What is something that you didn't think that cannabis could help that actually did? Are there any patients that you had that you're like, I don't know about this?
In the beginning, I was really nervous about working with kids. I had a bunch of teenagers, 17, one was 15, coming in with like migraines and chronic headaches and always nauseous, all the things. And at that point, we didn't have a lot of hemp product to try. So we were really looking for the high CBD, low THC blends. And those kids are doing great. That's great. Too, I think about it, like some of them are too off of the cannabis at this point. I didn't realize how holistic and overall how impactful that is. Like, we're used to, we treat pain with this, or we treat this with this. I didn't realize like how holistic, homeostasis, whole person this medicine is. And I've seen, pure depression, like couldn't go to school, was doing an online thing because she was just couldn't. A little bit of THC. We actually went with a 1-to-1, equal parts. Those types of depressive, like sad, anxiety type things. Well, not anxiety, but like sad, depression.
Well, like a serotonin kind of thing. Yeah. It
boosts, and then it also enables our brain to keep it in our brain longer.
Yeah.
So for those kids, a little bit of THC was working, but of course the goal was we didn't want to be stoned all the time.
Exactly. Yeah.
As a teenager, I mean,
I'm sure they wouldn't mind too bad.
I know, right? That's what one of the kids said. He was like, "It's cool. I don't mind it.
I'm good." Yeah.
But, yeah. So using those 1-to-1s, which I really like that. Like if you're really looking to treat like serious disease, like he has a really important role.
And sometimes you just, sometimes you have to kick it in the butt. You got to kick your endocannabinoid system in the butt. You got to wake it up and go, hey, what the hell? Get moving here. And that's what it takes. So, but again, doesn't mean they're going to be on it forever.
Yeah.
Let's see how your body works with it. So what do you think, what are some of the things that are really, really well suited for CBD? Like I know that Crohn's disease I hear a lot about works really well with it. What are some other things that you've had really good success with CBD, either as an isolate or as qualified industrial hemp with less than 0.3%?
The fibromyalgia and
really,
the folks who nobody knows what's wrong with them, but they know something's wrong. Yeah, and they're not living their best selves, and they're not thriving, and And it's those folks who they've tried everything else. Why not give this a try?
Mhm.
And then they're like, whoa, I feel amazing and
Yeah.
good. So yeah, it's those folks. And, we started out like, wow, the amount of like middle-aged women
Mhm.
coming to talk to us was astounding.
Yeah.
Yeah. I mean, of course, I expected the elders to come
Mhm.
and talk to me, which I work with a lot of elders. But like women my age, I was like,
Mhm. Yeah,
wow.
you know what? Once you hit 50, because I'm 52 now, and I start feeling things. I
Mhm.
feel things that I didn't feel 10 years ago. So, either aches and pains, or with menopause, the anxiety that kind of comes with that, and
Mhm.
it's
That's the endocannabinoid system.
yeah,
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 that anxious feeling
mm-hmm,
is not enough cannabidiol in those CB2 receptors.
yeah, and boy, it makes a difference.
It really,
It
really
Yeah,
does.
and I am so very grateful for that. So, but what? Oh my! I lost your picture for a minute. So people that are watching this on YouTube, hold on, it's coming back. There you go. What are some other things that? So the fibromyalgia, that's awesome, because there are a lot of people out there
Yeah,
who have been suffering for years, for
definitely.
decades.
Mhm.
Which is
Yep.
because there's just really not a good treatment for it. So what other things are you? What other symptoms do you?
I think the most potent change that I saw was with a couple of PTSD
Mm,
vets,
yeah,
all the way from, and they were on a lot of pharmacy, a
yeah.
lot of pharmacy. So that took a while to wean down off of that. And then that was kind of a interesting time when they were just starting only being on the cannabis.
Mm-hmm,
Some of their symptoms would come back, and they're
mm-hmm,
like, wait, oh no, I can't get off these medicines.
mm-hmm,
But then it continued. It would only take 4 or 5 days,
mm-hmm.
and their symptoms were changed. And all of those PTSD studies were done with hemp.
Yeah, yeah,
So that's available to everyone.
yeah, and that's wonderful.
Yeah.
Um, have you, just out of curiosity, have you worked with any animals?
Just my own.
Yeah.
Oh no, actually that's not true. I did help one. My auntie's dog was ancient and
Mm-hmm,
going to heaven, so he was on hospice. So
mm-hmm.
we helped him, and my dogs love it. I had a 18-year-old Italian Greyhound.
Oh, nice.
And
Mm-hmm.
we started giving it to her just out of the cupboard, right? And then
Uh-huh.
she'd go to the cupboard and like tap the cupboard when she would want her medicine.
Yeah, we have a Labradoodle, and once he knows I go, if I open that cupboard door, he is right there. He's like, yes.
Yeah,
So it's good stuff.
lovely. Mm-hmm. Yep.
Yeah, it's he's diabetic, and so since I've been really regular, because before I give him some here and there, but now that I'm being very scheduled with it,
Yeah.
the last time we were at the vet, he went down a full cc in his insulin.
Nice.
Yeah, so I'm about to take him again within the next, I don't know how long, and see, if we can maybe go down some more. Who knows? So,
And Don, that brings up a really great point in that, a lot of our chronic disease that we're trying to deal with, chronic pain, fibromyalgia, PTSD, it's not a one-time deal. It's not a take this one day and then not for a couple of days. You need to be
hmm
consistent with that, taking them every single day, really uploading that endocannabinoid system so then it can function better. It's like you're putting the building blocks there.
yeah, and so I gave it to him in the morning and at night when he ate and got his insulin, just
Mm-hmm.
consistently, and so your body knows it's coming, and it can. Yeah, you have to be consistent, and that's how I got off my asthma medication, was being very consistent with CBD. At the beginning, I didn't even realize that it was helping. I just realized that days had gone by before I'd taken my Advair or my Ventolin. I was like, wait a minute, what? And then I just have been, and there have been some times where I haven't taken CBD for several weeks, just for one reason or another. and and all of a sudden I had to start taking my inhaler again. I'm like, jeez, no, wait a minute, this is stupid. Why am I doing this?
Right. Yeah, great point though. Like, it's not like overnight. You don't feel like, oh, suddenly better. You just realize, oh, I haven't taken that in a couple of days.
Yeah, exactly. And so it's that's a wonderful thing. So how do you, when you're working with your people, because I believe that different things can be helped with different methods, even can be better. Like I love taking a tincture and capsules and stuff, but there are times when like anxiety raises its ugly head that, I'll go with a vape, or I'll go with, a gummy bear or something like that. So, and of course, like if you have skin cancer, topicals are good, but how do you go through the process of determining what method is best for your, for let's say, just give me any example, of a patient?
I use sublingual a lot. So just put it under your tongue and let it absorb that way, because it's really quite fast, and so you can tell what is working or not. If I have someone who's like never tried smoking weed like at all, because I think most of us like know, is it going to like kind of stimulate you, or is it going to kind of relax? And of course we know the phenotype matters, but just on it, is it up or is it down? If they don't know that, then a vape is where we start. And that's because it's instant. You can tell how you feel on it.
Yeah.
And you know when it goes away. Whereas if you put something in your mouth, depending on your personal GI tract and everything, it could take anywhere from 20 minutes to 2 hours to work.
True.
So if you're really trying to assess, is this working for me? And then also, what kind of dose do I need? Do I need 1 milligram or 20? It's a great way to start, because you can kind of look at that and say, oh, well, I vaped 20 times in the past 4 hours. So this is not getting it. I need a little bit more of a dose.
That's really great to know.
Right? Yeah. It's a good way to start. And, you can get them for fairly inexpensive.
Oh, for
Again,
sure.
You have to know your source.
Yes. Again, people, you have no idea how much CBD oil is coming in from overseas. And I'm not saying it's all bad, because there's some stuff coming over from Denmark and from Canada, whatever. But
we've got great farmers here in the U.S. Let's support them.
Exactly. You don't need to go overseas to get it. So, okay.
So,
and what about for like some examples of topicals?
Oh, I suggest topicals all the time. Our skin is magic. It takes in what it needs to take in, and then it will like close off those cells if it gets too much. So it's really awesome to be able to put it right on the tissues, whether it's pain, whether it's, a burn or whatever, right into those tissues. And that doesn't cross the blood-brain barrier, so you don't get stoned if you're using a high THC topically.
Right. And if you're using a CBD, you don't even have to worry about that at all.
Yeah, exactly.
So like if you're using one of George's transdermal patches. And so we were talking about it. It just dumbfounds me that, okay, so it's used as a method to get the CBD into your body, but it's not necessarily just for pain. Because I'm thinking patch, first thing that pops in my head when I think of transdermal patches, I think of lidocaine, or something like that. And like, oh, okay, yeah, you slap it on where it hurts and it makes the pain go away. Duh. But that's not necessarily how a CBD patch works.
Nope. Yeah.
That's very confusing.
Yeah, if you want to get it right in those tissues, then you want to use a salve, a topical, a lotion. If you want it to systemically, then those patches. And think about the nicotine patches. And what's the other one? For motion sickness.
Oh, yeah.
You
The
know,
ones that you stick behind your ear.
yeah, it's the same theory. It's the same, like our blood can pull down those molecules from the patch into the tissues. And I'm not the best person to describe it. Synergy Skinworks is amazing, and they
Yeah.
actually do a great job of telling how it works. But a really potent, and then that gets your whole system. That's the whole endocannabinoid system. It's not just topically treating your sore muscle with CBD.
Yeah.
You know, so it's kind of more effective in that it touches all those receptors. It's CB1 and CB2 receptors. Whereas you just put it topically, you're just getting that peripheral CB2.
Yeah, because like I have several salves and lotions and stuff that I've tried, and I think a lot of that has to do also with the other oils that are in there with it that are helping to pull it down into the body and stuff like that with the muscles. And as an herbalist, I'm sure you've got 50 different things that you can say about that. So.
Oh, we could talk all day. So I'm also a doTERRA wellness advocate. They're essential oil industry. And what essential oils are basically terpenes. So we can gain all of our information and science from the essential oil industry. If you want to talk about, lavender and how it helps, and then the phenotype that works well with it, we've got tons and tons of science. So I'm telling people you can no longer say there's no science for us, because there's a lot of science for us. Even if we break it down, like the isolate, that citrus CBD, if we break it down to the isolate of the limonene and the lemon essential oil, or that infusion whole plant ensemble effect, like the Siskiyou syndrome stuff.
Yeah, exactly. And I gotta say, we need to give some props to the essential oil industry over the last 30 years, because they have given us a lot of information to build upon.
They really have. And it's so good. And that's where we can really fine tune the cannabinoid therapy. Because I'll use my oils like, is this lavender more attractive to you than the lemon, or what's happening? Then we can focus the phenotype of the medicine from that. It's amazing. And being in the dispensary, it's really cool to see how people respond. They'll take a jar and smell it, and they'll either like go closer or they'll like go far back. It's like they have that innate, like, oh no, that one's not for me. Oh,
listen to your body. Yeah.
Listen to your body. Exactly.
For sure. So do you work out of like just one dispensary, or do you go to some different ones? Or how does Converse with the Nurse work?
Yeah, great question. So we started out of one dispensary, and now what we're doing is we're just going around to different dispensaries, educating their staff.
Nice.
We found that we don't have the time to like just hang out in the dispensary for a few hours. So we're going around teaching staff and teaching the bud tenders, and then they can refer the patients, or the clients, I shouldn't call them.
Yeah, I screw that up sometimes too. Yeah.
For the people, and the people can contact us, and we'll do consults that way.
Oh, that's nice. That's nice.
Yeah. And if someone has like one simple question, just send me an email. I can write back, or if you just got diagnosed with breast cancer and you want to know like what's the treatment plan like, I can tell you what my treatment plan has been and what I've seen other women be successful for. So it's like that. You can go on conversewiththenurse.com and book right there, pay right there, like take care of things.
Yeah, that's great.
Basically our goal is just to educate. And we're really working on doing like this, more webinars and podcasts, and just getting out there so that people can know that we do have the science to back us up,
Exactly. And that they're not alone. They don't have to go it alone.
Yeah, and you don't have to like just try it. Early on we saw so many people that were ending up in the ER because they just got this free joint with their CBD oil. And so they'd smoke the whole thing and then be like, whoa, my heart's racing. Well, yeah, that was an overdose of THC.
Yeah, your brain. Well, and I hate to use the word overdose, but
Yeah.
but yeah, you got more than what you are handling. It's not. Yeah, it's not a fun feeling when.
No,
and I've
no.
done that before, trying to get rid of a migraine.
Oh,
And but mine are more hormone migraines. And so the THC just doesn't always do it. And so I just thought, well, I'll just keep smoking until it goes away. Well, got to the point where I'm just sitting there and it's like, I had to put a towel in my mouth because I couldn't remember how to swallow my saliva. And I was a raving idiot. I was sitting there going, what have I done? Why did I do this? I am an idiot. And then so I was like, give me some CBD. Let me counter some of this. I can't deal with this. So
yeah, which that's good point. Like CBD can help bring you right down. And you know, when we're talking about our elders using this medicine too, they are more sensitive and less sensitive at the same time. So it can take more medicine for them to feel the effect. Or it can take less medicine for them to feel the effect. It's like a paradoxical, you know, so you have to know, like I said, and you know, if you have never tried it, is it up or is it down? You know, so you want to know that feeling. And yeah, I mean, you give a elder lady a joint to smoke the whole thing and she's like, whoa, what's happening?
Yeah, it's scary. It can be really scary. I know that.
Nice push with a couple of the ERs around to talk about like what's happening to all these folks. nurses were like, we don't know what to do. I'm like, give them a bag of cookies and the remote control.
Yeah, let it chill for a while. Make sure they're not watching Twilight Zone because that might make it worse. So, but I know with my mother, I would give her kids and her pain. She can't take anything now because her pain doctor said that he was going to fire her if she tested positive for THC. And
oh, yep, we saw a lot of that.
Yeah, so
in the beginning.
It's a bunch of anyway. So
well, and that's just we just need to educate those physicians.
Yeah, unfortunately, she's in a non-legal state. So
yeah.
But that's the thing is that even taking CBD, even when she got off the THC, she was just taking CBD. It was industrial hemp. Had enough in it that she was testing positive just because of the trace amount. She's a little bit heavier. Fat cells store it. She's screwed. So, but like, she was great with even just half of an edible. So 5 milligrams of THC, and it made her night's night and her day's day. You know, she didn't flip. You know, the night and day. She got a great night's sleep and stuff like that. But, so. Yeah, so with the elderly, you might want to start slow and then just kind of build up on that. Don't freak them out.
Start slow. Yeah, Oregon's tagline is "Go slow, go low."
Oh, okay. There you go.
So you start low and slow and go up, and then
To be honest, even myself, if I have like a 10 milligram, I can't even. I'm 5 milligram girl. I'm such a freaking lightweight. It's disgusting. But yeah, I'm just ridiculous.
You're a one-hit wonder.
I so am. That is awesome.
It's like, if you want me to do happy house cleaning day, then let's smoke a high THC blend and we'll be cleaning for hours.
Yeah, let's do. Give me that would be a sativa, right? For me.
Yeah.
So yeah, I take I can deal with 5 milligrams of an indica before I go to bed, as long as it's right before I go to bed, so I can just lay down and go to sleep.
Yeah.
Oh my gosh, so silly. So
because that is potent. Actually, that is a really good point that I wanted to say too, is you need to know if the THC is a little stimulating for you, because even if you take an indica type at night, it might still be too stimulating. You might need less THC and more CBD. So that's where you really want to know your dose before you head in to using it for sleep remedy. There are a lot of other things that I like to teach people about sleep hygiene before they start in on the cannabis. Now, the hemp stuff, it has such a low THC that I haven't found any contraindications for sleep.
Interesting. And but we also have to remember that everybody's body is different, and that's why it's really important for people to take responsibility to learn about it and to keep track of what they've taken and how it affects them. You know, this is not like some doctor giving you your Oxycontin to make the pain go away. So this is a wonderful opportunity for you to own your health.
Yes.
And not everyone's body is the same. Like for me, 5 milligrams, that does it for me. For other people, it could be, they could smoke an entire joint and be fine. Yeah. So, but own your health.
I do. I think cannabis is the gateway drug, but it's the gateway drug to self-care because it's one of those plants that you really have to check in with yourself. Because if you're not doing that, then it's either not going to be effective or it's going to be way too much.
Yeah.
So I love that it's the gateway drug. Exit drug from pharmacy, enter self-care.
Self-care. Yeah. And I just, I think the time is right. I think people are becoming more and more aware of the importance of self-care, and it's a great opportunity for them to take responsibility for it. And to be honest, there's nothing scary about it. Just start out and get in there, but really use the resources that are out there. Use people like Rebecca, and unless this is something you've been doing already and you've got it down and you've listened to your body and you've got a good oil that you're using, or a good tincture or what have you. But it's always a good idea to have that professional there that you can ask questions of, and it takes the guesswork out. Let her guess.
We've done a lot of study and talked to a lot of people. So we've got a good handle on this plant, I think.
Well, and that's the thing, is that you've been trained in the science of it.
Yeah. Oh, geez, I love it so much.
Yeah.
Sometimes I get I really try not to speak too much science, so I didn't use too many weird words.
No, well, okay, the phenome thing is a little out there, but that's the thing, though, is that people need to realize this is not. I fucking hate it when people say miracle drug. I want to fucking punch someone. There's nothing about a miracle in this. This is science, and honest to God, throat punch coming. If you face to face call it a miracle drug, I'm gonna frickin' throat punch you. Yeah. This is science. Shut up.
Yep.
So, so I think it's really good that you're using, the appropriate terms and stuff like that. I like the fact that you're saying cannabis and not marijuana, because that is a scientific name for the plant.
Yeah. And marijuana was based in racism.
Yeah.
So,
people. Yeah. Some people just need to be slapped. But that's okay.
Right.
So there is a science to it. There is a reason that it works. There is an endocannabinoid system, although it has not been taught to doctors, to maybe recently. Well, I know there's some CCEs out there that's finally teaching it to doctors. And they need to get on board, because it is the key to the health of your body. The endocannabinoid system. That's it.
Whole system.
Yeah. So they better start learning it. And I did one once before. It's like, you know what? I can understand, that you didn't understand, that you were never taught this, but there are CCs out there. There's what is it called? Continuing
education.
Yeah. So go take the freaking course and learn something, and start helping your patients better.
Yeah. And one thing we do too is Micah and I have been doing physician talks.
Nice.
So we'll go into a practice and it's pretty general, like, science about it. But, if that's something, we've got this beautiful interweb. So if you have a group of pain docs that you want, to talk to us, like definitely reach out, because we're finding that to be hugely successful as far as impacting people.
Yeah. There's something about face-to-face.
Yeah.
It's not a phone call. It's, and that's the thing is when you go on with Converse the Nurse, you will be doing a Zoom call.
Yeah.
So, you get to talk face to face and see each other, and you can go, oh, see this spot right here? So
that makes me laugh, because being a nurse, I can't even tell you how many times people have said, hey, will you look at this weird thing?
I'm sure. I'm 100% sure. I still call my sister. I'll take a picture of something and text it to her. What's this? Yeah. She's like, what the fuck, Dawn?
It's good.
It's like, well, when I owned a mortgage company, I told you all about interest rates and stuff. So turned out it's fair play. But yeah, it's a great way to create that relationship, the face to face through the internet. But
Great.
I love the fact that you're working with doctors though, and that it can be a doctor in Iowa.
Yeah.
It doesn't it doesn't have to be somebody in Oregon. You can help with them, and that's a wonderful thing. So, but truly, if your endocannabinoid system is out of whack, I don't care what medicine you're taking, it's not going to be very effective. It's not going to be as effective as it could be if your endocannabinoid system was working, if your messaging system inside your body was working at an optimal level. That is what's going to help you. That's good, and that's also good. What's going to help your medicine get through faster. So
yeah. So opposite to contraindication, we have potentizing effect, which is wonderful,
Oh, tell me about that.
Well, it's just the same, it's if you're taking CBD along with, then it's going to create, like you said, those receptors, that messaging system, so that those pharmacies will be more effective. And we found that primarily with the study with kids in epilepsy, is, their pharmaceuticals were more effective when taken with CBD early on. Now they're saying CBD and THC are both very important in epilepsy. And people are getting off those pharmaceuticals, because those pharmaceuticals are heavy hitters, big time. It's not like
I mean that if an adult was taking those pharmaceuticals recreationally, and got hooked on them, the rehab on that would be horrific for them. It'd be absolutely horrific. And so that's one of the things, like with like with the grapefruit thing. So like if you're taking like warfarin or Coumadin, you're not supposed to have grapefruit with that. So you wouldn't want to have CBD with that unless you have a doctor who is willing to work with you and test your blood regularly to see, how it's affecting it. If you've got that special doctor out there who's like, okay, well, if we can lower your warfarin or your Coumadin by bringing in some CBD, let's do it in a controlled fashion. Let's test regularly. Let's, make sure that that you're not going to bleed out when you brush your teeth and your gums start bleeding. Then there are ways to use it, and careful ways to be able to switch over. Nobody's saying stop taking this and start taking that. That's not the way to do it.
No.
It's dangerous.
And safe. Lots of safe options out there.
Definitely. If you look at the side effects of a lot of these pharmaceuticals, if you can switch over to CBD or even full plant cannabis, that's the way to do it.
Because all of these pharmaceuticals started out as plants. So
until they threw all the chemicals in there.
Yeah. So this is what we're doing. We're going back to our native medicine. We're using plant medicine. I love it.
All right. So if you have one final thing that you wanted people to know about, well, let's just go whole plant cannabis.
Okay. One thing that I would like people to know,
Yeah, you
is,
want them to remember for sure.
remember for sure, is it's not scary. Just try it. Go low, start slow. Start low, go slow, whatever it is.
Mm-hmm.
Just give her a try and really check in with your body
Mm-hmm.
before you start, even if it's 2 seconds in the bathroom where you're like, okay, head, eyes, nose, and toes, how
Mm-hmm.
do I feel? And then you take your medicine, you go back half hour later, whatever, an hour later, check in again, like physically, like really check in, because you'll be able to tell, is this helping or not at all,
Mm-hmm. Yeah, that's a great thing.
Mhm.
And my thing is to let you know that if you're afraid to do this, you don't have to do it alone.
Yeah, you don't have to do it alone. Good point. Yeah.
Yeah. Just
Hmm.
there's a lot of people out there that know a lot about this plant, and um, just like go to conversewithanurse.com,
Yeah.
book an appointment, get some professional guidance on how it can help you, and what to take, and that way you don't have to worry about, oh, which medicine am I taking? Am I taking too much? Am I taking too little? Should I do this? Should I do that? Should I go with a vape or a tincture or a gummy or a salve or I mean, geez Louise, there's so much out there.
Yeah.
I can understand why it's overwhelming. And okay, I'm gonna make a stupid comparison here. But for those of people who have had an instant pot, and have sat there and stared at it because it's so overwhelmingly confusing. It's
Oh,
the instant pot's got like 10 different settings and stuff, and then they're like, and I've known people who've had it for months, and they're afraid to touch it until they have someone guide them and say, yeah,
yeah.
push this button, and wham
Good
bam, thank
point.
you, ma'am.
Yes. Perfect.
For
Yeah.
the women out there that are listening, yeah, for the women who have instant pots, and you understand what I'm saying,
Hmm.
just get someone to hold your hand and walk you through it and give you some guidance. And then all of a sudden you're going to realize, oh my God, this is the best thing that I have ever done for myself.
Yeah.
And it really can change your life. Cannabis, CBD can literally change your life and in instances save your life. So
Yeah. I've seen lives transformed.
yeah,
Hmm.
it's a great thing. It's a
Yeah.
great thing. All right. Well, we will have Miss Rebecca C. White back again. But
Love
for
that.
yes, definitely. But for tonight, everybody, thanks for joining us. Stay happy and stay healthy, and we'll see you in the next episode.
Awesome.
7, 6, 5, 4, 3, 2, 1.